Ini belum diganti tau namanya.
Iya, bentar.
Oh, bukan yang FHC emergency. Mana info tuh?
Hello, our respected judge and friends. We are from HerInsight Lab. We want to address our topic for this ASA DataFest competition, which is cardiac arrest in Stormont Vail Hospital. Next. Cardiac arrest is defined as the sudden termination of mechanical cardiac activity without evidence of the circulatory signs. It is associated with high mortality rates and is a significant global public health challenge. Our team's aim is to explore the high mortality rates among cardiac arrest patients based on the provided data. Our first finding is there is an increase in overall patients diagnosed with cardiac arrest admitted to the hospital. There's especially a 27 times increase of patients diagnosed with cardiac arrest in 2025. The increase in recorded cardiac arrest cases can be partially linked to improvement in diagnostic abilities. Enhanced cardiac monitoring technologies such as X-ray, stress tests, and a screening ECG have helped the identification of cardiac arrest. In spite of improvements in diagnostic abilities, there is still a high mortality rate due to cardiac arrest as reflected in the line chart. In 2025, 56% of them passed. This means more than 1 in every 2 patients. By looking at the trend, this isn't a stable problem. In 2022, only 3 patients passed. In 2025, 82 patients passed, a 27 times increase in 3 years. Next.
Then we found that an estimated 91% of cardiac arrest-related deaths occur among individuals who have prior visits to the hospital, yet the system is inadequate in managing the crisis. On the contrary, cases of cardiac arrest occurring in individuals with no prior visits to the hospitals turn out to be rarer, only about 9%. Previous study reveals that there are vital signs trajectories of deteriorating patients and has potential implications for prevention of in-hospital cardiac arrest. This means that the majority of deaths are actually preventable, if only there's a better cardiac arrest handling system. We also found a positive correlation between ED visits or emergency department visits and hospitalizations on deceased patients. An estimate of 19% of patients came to the emergency but were not admitted to the hospital. It is a sign that these patients enter and leave the hospital without receiving health stability. That decision to not admit them may have cost them their lives.
We also found data from a few departments reveal difference in patient outcomes among cardiac arrest cases, suggesting the hospital department level contributes to overall mortality of cardiac arrest deaths. Emergency department with department key 20 manage 52 cardiac arrest cases. 50 result in death and 2 in survival, producing only a 3% survival rate. On FHC emergency with department key 11,070 188 recorded 32 cases with 27 deaths and 5 survivors, producing a 15 survival rate, while her Sandra Pacemaker Clinic department managed 20 cases, which 19 result in survival and only 1 at that, for a survival rate of 90. The difference in case survival rates between these departments suggests that the outcomes are not consistent across all department settings. However, the difference in outcomes highlight that patients experience cardiac arrest do not have the same opportunities for survival and depend on which department they have are treated. So here are three recommendations. First, implement cardiac risk screening at every routine visit. Since 91% of disease
Bentar, sorry Al. Maria, kamu lupa ngegeser ya? Ulang aja kah guys? Boleh ulang aja nggak?
ulang bagianku aja nggak sih? Nanti
Oke.
dipotong. Oke. We also found data from a few departments reveals difference in patient outcomes among cardiac arrest cases, suggesting that hospital department level contributes to overall mortality of cardiac arrest deaths. Emergency department with department K20 manage 52 cardiac arrest cases, which 50 result in death and 2 in survival, producing only a 3% survival rate. On FHC emergency with department key 11,788 recorded 32 cases with 27 deaths and 5 survivors, producing a 15% survival rate, while Heart Center Pacemaker Clinic Department managed 20 cases, which 19 result in survival and only 1 at death, for a survival rate of 90%. The difference in case survival rates between these departments suggests that the outcomes are not consistent across all department settings. However, the difference in outcomes highlight that patients experience cardiac arrest do not have the same opportunities for survival and depend on which department they are treated. So here are our three recommendations. First, implement cardiac risk screening at every routine visit. Since 91% of disease patients have prior hospital contact. Second, audit patient intervention. Investigate why cardiac cases in the emergency department have a lower survival rate than her center department. Lastly, replicate her center department protocol so her center depth achieved 96% survival rate. This means her center depth protocol should be standardized across all departments. The data is clear. The problem is specific. The solution is actionable. This is has everything it needs to turn that red line around. Starting today. So that is from our presentation. Thank you for your attention.